Hi guys, today we're at CCR in Excel, London, early in the morning. We've got our Starbucks, so let's go. Come on. Yeah. Something looks interesting over there. Everyone's got headphones in. Shall we go to have a look? Come. Oh, it's Dr. Abs Patali. Look at it. So we're learning a little bit about psoriasis and redness and how we can help that with LED therapy. It's really interesting. I recognize her. Hi. Hello. I think I recognize you. We met at IMCAS, didn't we? Yes, we did.
Did your hair grow?
It has a bit.
How are you doing?
I'm good. How are you?
Good.
Good. I'm going around CCR today, just like speaking to a couple of people. I've got my colleagues here who are recording for our lovely. Oh, sorry. I've not gotten used to doing this.
Oh, no, I'm not used to doing that either.
No, but I was telling them I actually started using the products that you gave me, doing a bit of a trial run on my colleague here. So we've been using the Dermapen along with some of the products that you have here as well. The hyaluronic acid. Yes. I used it on my lovely colleague Neff over there, whose skin is currently glowing.
You've got great skin.
Yeah. So we wanted to hear a little bit more about your products and like some insider information, like what you think would be really good for people now that we're moving into winter, maybe.
Oh, okay, yeah. So definitely moving into winter, getting drier skin, ramping up the hyaluronic acid. So adding in a hyaluronic acid serum or a pure hyaluronic acid, as we do with the Exelaris and the ampules, and also looking at putting in like moisturising masks. So introducing a treatment into your routine, just sort of once a week. Can be a sheet mask, can be a cream mask. I think that's the main thing, isn't it? People swapping over from different textures, from lotions onto creams. Yeah, that kind of thing. So.
Yeah, that's really good advice. As you can see, my skin is starting to become a bit dry recently. I was like trying to lather on as much moisturizer, but sometimes you do need like more powerful medical grade kind of skincare, like the range that you have, like the hyaluronic acid, and you do need to go to do some in-clinic treatments as well. So yeah, thank you for that.
That's all right.
We're going to go and look for our InMode family and friends, as we've been using their lovely devices recently, the new Quantum RF, really exciting, been introduced in our clinic. So let's see where we can find them. So I've just spotted the InMode team, and I also spotted Dr. Vincent as well, who is a really good doctor, uses the InMode device as well. Hi, Vincent.
Oh, hey.
Hello.
How are you? Good to see you.
It's good to see you again.
You too.
How are you?
Not bad, not bad.
Not bad.
How are you finding CCR?
I'm finding it very well. Very hot in here. Yeah, but you're looking amazing today.
Thank you.
So I heard you're doing a bit of a talk later on.
Yes.
Birdie told me.
Yeah.
Tell us a little bit more. I know that you've purchased a new device as well, and we've also got it in the clinic.
Yes, absolutely. So this is the new Ignite platform from InMode, and I'll be speaking about it at 2:30 p.m. today. So basically going through what's new with it, a special quantum handpiece, which everyone loves.
Yes.
So patients are getting faster results, better results, and the downtime is so much lower, and it's a lot faster for us as well.
Yes,
Yeah.
I think the downtime is always something that a lot of patients find scary, and it's good to know that we've got like a more powerful device. So what is the most popular treatment that you're finding in clinic at the moment?
Ooh, I would say combination of the quantum tan on the face and also the Accutite. So
And
those
the
two combined together.
Oh, okay.
Yeah.
So patients are getting that nice snatched jawline that they're wanting. Yeah, I can feel some of my jowls also coming in.
We'll treat each other.
We'll treat each other. Yeah, you do mine, I'll do yours. That'll be perfect, honestly.
Amazing.
But that's good. And can you tell me a little bit about the science? I know a bit of the science as well, but you know, I'm one of those people that's a bit of an airhead, so I can forget sometimes.
Okay, so it's all bipolar radio frequency, and obviously with the Morpheus 8, we can go now up to about 7 millimeters deep, from 0.5 to 7 millimeters. And then with the quantum, it's fractionated bipolar radio frequency with no upper temperature limit, so that we can go as deep as 16 millimeters, so up to 6 centimeters.
Zap away all that fat immediately.
Really? Yes.
Yeah, no, wonderful.
Awesome.
Anything else you wanted to add as well? Like, if you could give us a little bit of a sneak peek, a little hint. That's okay if you don't want to.
No, like I would say this handpiece is amazing because you can do the burst and scale mode. So then it saves a lot of time. So with one pulse, you can treat different layers at the energy that you want.
Yeah.
So it's more personalized, which goes hand in hand with, you know, we're entering an era of personalized beauty, right? So everything has to be personalized these days. Yeah.
Oh, wonderful. Thank you for all of that insight and information. And I agree with you. Personalized treatments are along the way. Congratulations on the new clinic as well. We're looking to see lots of great things from you in the years to come. And I'll hope to catch up to you soon as well.
See you soon.
See you soon. Thank you.
Bye.
Bye. And I've just spotted a lovely skin analyzer by the company Atta. So we're going to go and have a word with them and see what they say about it. Oh, sorry. Hi. Hello there. How are you today?
I'm well, thank you. How are you?
I'm good, thank you. I'm Dr.Bisma, by the way. I saw that you've got some lovely devices here, the skin analyzers. And would you be able to introduce yourself and tell us a bit about them?
Yeah, so my name's Lutfia. I'm the sales director with Opatra. We are known for cutting-edge innovative products. I would probably say the skin analyzer is probably one of our number one products. And the reason for that is since obviously the time of COVID, more and more clients have almost become a little bit more wanted to educate themselves on skin health. Educating themselves on their own skin health. They no longer want to be told, we advise that you have this. It's more a case of everything is why. Why do I need to have this? Why do I need to invest more in my home kit care? Why do I need a course of treatments? And what the skin analyzer actually allows you to do is look at the dermis and the epidermis layers of the skin to show the client actually what they cannot see in the mirror. Because we all have a misconception as to what we see when we do look in the mirror. And the analyzer allows you to take your clients on a visual journey. So it's a customer experience. It's not to replace the doctor's knowledge, or it's not to, replace a practitioner's recommendation, because you're in full control of what the device does. So what that means is you'll have 10 different skin conditions to look at, and you can program the system with your own treatments within practice and your own retail products that you offer. So the system will only recommend what you offer as a business.
Okay, so that's really interesting to know. So it gives patients like a little bit of a bespoke treatment plan, essentially based on what they can do in the clinic, and
Completely tailored.
It's
completely tailored to their own needs.
that's really good to know, because we have a lot of clients that come in. They say that their skin is dry, and when we start treatments, they don't tell us that they see noticeable differences. Would you say that the the skin analyzer is able to pick up those differences?
Yes, because it gives a comprehensive report. So in that report will be the initial analysis. It might be that they have dry skin, so then you have a whole course of program that you would take them through. And then what you would also do is you'll be recommended to compare. So reanalyze the skin possibly in the middle or at the end of the course of treatment, and reanalyze to show them the improvements along the way.
Okay, that's really good to know. And what parameters does it kind of tell patients about, like their pore sizes, anything else?
So it looks at the size of the pores, it looks at age spots on the surface of the skin, fine lines and wrinkles, texture of the skin, Then we start looking under the skin, so we look at porphyrin bacteria. Obviously, that's great if you do have oily skin. It's good to sort of show where that bacteria is. Pigmentation that's forming under the skin, UV moisture levels, because sometimes if the texture of your skin isn't the best, doesn't matter what products you're using, it will not sink into the deeper layers of the skin. Okay, so that's great to show your clients actually we really need to improve the texture and your UV moisture levels so that those products can sink in deeper for better results. We look at sensitivity, we look at inflammation of the skin, we look at skin cell metabolism, UV damage, but the best part is you can actually show the clients how they will look if there are no interventions. So if you do not improve skincare routines, the treatments, it will show you how you can age over a 3 to 5 year period.
Wow, I find that really fascinating that it tells you and it shows you what will happen if they don't take their skincare seriously.
And that's the point. People no longer want what I call the old-fashioned way of pen to paper skin consultations. They want to see, they want to understand, they want to be with you on that journey. And this is what you show them. You just said, I find it fascinating. It's exactly what the client does. The client finds it fascinating because it's about them and they can see.
Exactly. Well, I'm so excited to maybe give it a try as well and find out a bit about my skin health this winter. I love that it goes over multiple parameters, as you mentioned, oiliness levels, bacteria, UV exposure. I think that's a big one that I think everyone now is picking up with UV damage, how that affects them over the years. So
there's no one that should leave any clinic, in my opinion, without at least purchasing an SPF. Once you see the damage actually UV rays do have over many years, like you said, even from childhood, you want to protect all year round, and that's you're making a difference to somebody's life. That's the important thing. The newer version, which is the Dome Pro, also has a magnifier, and what that allows you to do is actually possibly look at the scalp.
On the scalp as well. Wow.
Or if you offer laser treatment, sometimes the client says, oh, my laser treatment didn't work. Actually, you can show them whatever area that is with the magnifier where the hair has died.
Wow, that is a magnifier as well. I think you've got everything combined in there. This is something, as you said, that's your daily reminder to always reapply SPF as well, guys. I think, and this machine is a way of really putting patients, I think, in the hand, it puts a lot of the skincare and their routine responsibility onto the patients as well, because they can see.
It's never a one-time win. You don't want that client to come to you that one time. You want that client to actually take their skin health seriously. Because it's skin health. Take their skin health seriously and go on I'm going to use the word again, journey, because it's an ongoing journey.
Yes, it is.
And this actually proves that.
Yeah. Well, thank you very much for doing the interview with us. I hope we didn't keep you too long.
Thank you.
Thank you. So I've spotted another familiar brand, Cynosure. We have the PicoSure laser in clinic as well, which treats pigmentation, tattoo removal, and it's also really good for acne scar removal as well. So let's see if we can find our friends and family at Cynosure. So we're going to say hi to our Cynosure family now. I spotted the PicoSure laser. Hello there. Hi, I'm Dr. Bisma. Lovely to meet you.
Hi, I'm Fiona.
Nice to meet you, Fiona. Oh, sorry. I'm getting not so used to moving the microphone, but Fiona, it's lovely to meet you. We're today at CCR. I just wanted to get a bit of information from you. How's everything going? We've introduced the PicoSure device into the clinics, brand new. I just wanted to know what's happening with the company. Are you doing any new trials on different types of patients, different skin types? What's happening? What's the latest news?
Sure. So, you have the PicoSure Pro, which is our latest version of our PicoSure system. We were the first company to be able to harness picoseconds for aesthetic treatments, and the PicoSure Pro is just the latest, greatest version, basically. So you've got the latest kit on the market.
We've got the most powerful kit then, yeah. So for those people that don't know, what do you mean when you say picosecond?
So older lasers tended to be Q-switch lasers. the PicoSure Pro works with picoseconds, which basically means that traditionally lasers work with thermal actions to destroy their target. However, with a picosecond device, they're actually using a pressure wave to break down their target, which is better for patients in terms of the less downtime because they don't have that thermal injury so much. So less downtime, less redness, less swelling, so it's better for patients.
Yeah, I can definitely say that patients are pretty happy after the treatment so far that I've done. They have a bit of redness, which is standard, normal, but it tends to go down very quickly. And I have patients coming back to me asking if they could see me sooner than the minimum 4 weeks that I give them for their treatment intervals.
Yeah, it's something that goes down really well with patients. I mean, I've had a PicoSure treatment in the day, and then I've done a workshop in the evening about PicoSure, speaking on stage, and it's absolutely fine. People can't even tell I've had a treatment, which is why it's great that the results are also so good, because often with devices that you don't feel like you've had the downtime and you don't have the heat afterwards, you think maybe, oh, it's not as powerful or it hasn't done its job, but actually the results are also incredible, so it really is a win-win.
It really is a powerful and amazing device. It takes up all the power in the clinic as well, as we've noticed. We had, but it's really good. And as we're moving into winter, what is it that you would kind of recommend in terms of patients coming in to do the PicoSure? Is it for everyone? I mean, some people, they always ask me, they're like, oh, my skin is okay. What can the PicoSure kind of do? Like, where do you think it would be good generally for most patients?
Sure, I mean, it's a great question. I think now is a great time to be treating post-summer pigment. So after summer, people have been away on holiday or whatever, and they may have picked up some post-summer pigment. So it's a great time to start doing those treatments. It's also something that we're starting to see people are looking for microblading removal. So people who have their eyebrows done and they're not happy, that's another treatment that's getting increasingly popular with the PicoSure Pro. It can be tricky to treat, but we've got doctors who are doing an amazing job with it. So that's definitely an area of opportunity.
Yeah, definitely. I will say that I've encountered a lot of patients that have come into the clinic, again, with tattooed eyebrows. I don't think when they mention that they're semi-permanent tattoos, I don't think some people realize just how permanent they can actually be. So it's good to hear that there is a bit of a solution, because there are a lot of frustrated patients out there that have gotten those done. They've tried to wait for them to fade, but they're not faded, and they've tried other lasers and it's not worked. So it's good to hear that they've got a treatment option out there.
Yeah, it's a real opportunity area for sure. Good to know that there is a solution out there, because there are some bad eyebrows.
Yeah, I can second that, and I do eyebrow transplants. So thank you very much, Fiona, for that insight. Did you have anything else that you wanted to let us know? Any upcoming news or anything like that?
I think the most important thing to note really is that it's such a versatile system, and it's suitable for all skin types, because that's something that can be really tricky to treat. Pigment, particularly on darker skin types. With a thermal-based laser, you do have that risk of post-inflammatory hyperpigmentation. So with the PicoSure Pro, it's just really nice to be able to not turn people away, where maybe historically in the past you may have had to. So yeah, I think just watch this space.
Yeah. Well, thank you very much, Fiona. Thank you for your time. So we're here as well at the Aesthetic Journal Arena, and just a quick shout out that we got our first article published in the Aesthetic Journal for topical hair loss solutions. So I'm here at the Jean Marini stand, and I'm going to be speaking to Nina, who's going to be telling me a little bit more about the products. How are you today, Nina?
I'm really good, thank you.
So, can you tell us a little bit about the Jean Marini range, a little bit of background of the brand, and why it's really good for customers?
Yeah, so Jean Marini actually herself, she was a product formulator. So her background in product formulation and ingredients is very, very extensive. So she started her skincare journey in the late 80s, but started this new brand in 1994. So we now have over 30 years of data and clinical data in terms of how the products work and the results that we can get for client skin. So we have a really wide range of products, but our key system is the thing that we would always go back to for general skin health and incredible results for your patients as well.
Wow, lovely. So it's good to see that you've got some data. It's really science-backed as well, evidence-based.
Yeah.
What would you say, are some of your best sellers, and why?
So the skincare management system in all its different forms is always a bestseller, because each of the products can support skin health at every level. and we can treat multiple skin conditions in one system. So it makes it a lot easier for you to recommend that solution to your patients. I've personally had an incredible result with it as well, so I would always say that. But each of these products, these 5 steps, are always our top selling SKUs as well anyway, so yeah.
Perfect. So can you give me like an example of like what kind of skincare concerns these products can like target, especially for our customers?
Yeah, absolutely. So as I said, we can target multiple concerns in this one system. So anything from acne, skin barrier issues, pigmentation, general aging, congestion in the skin, not necessarily like active acne. So yeah, rosacea, again, another main one, pigmentation, and we can again accelerate those results with further serums too. But in terms of the kit, the world is your oyster, really. I think in my experience, I've seen a lot of clients who have maybe got breakouts, but they're also concerned with aging, and you can't, with a lot of skin brands, you can't treat those things together, whereas actually with this we can. So it's a great solution.
I love that, because like when you talk about, you know, targeting multiple concerns, not everyone comes in and they only have one skincare concern. It usually comes with a multitude.
Yeah.
And now as we're going into winter, like what would you recommend for like in general for most clients to look out for, and what products would you recommend at this time?
So I personally would still stick with the skincare management system. It may be that if clients know that their skin gets a little bit drier in the winter, to switch to the dry formula, which gives like a cream version of some of the products rather than a lotion. I really love the Hyla 3D range for winter as well though. So we've got the Hyla 3D mask, which has just been launched a few months ago, and then also the Hyla 3D cream. So again, for that really kind of comforting, richer texture of a creamy product that people might want to use if their skin feels drier in the winter. So yeah.
Oh wow, okay. Do you have any products that we could like have a look at, like the Hyla range that you just mentioned?
I don't actually know if we've got it here.
Oh, we don't know if we've got it. That's okay, no worries. But why don't you show us some of the creams here at the moment that you've got? Like I see the face serum as well. So tell us a little bit about the ingredients, and maybe we can try it and open it up.
Yeah, so Siesta Serum is a lipid-soluble vitamin C. So this means it's less reactive and a lot easier to absorb on the skin. So we always shake it to wake it. So in here you've got something called DMAE, as well as your vitamin C, which is the ascorbyl palmitate. So as I say, with a lot of, we can massage that in as well.
That feels very luxurious, I will say, and it smells amazing.
I mean, that would cover your whole face and neck, to be honest.
Yeah.
But this gives you that antioxidant protection that every single skin condition needs, without the irritation that some people get with vitamin C.
Vitamin C, yeah. I can feel it on my hands are very, very dry, and it does not feel like it's stinging or burning or anything like that. It feels really soothing, very luxurious. I really like that. It smells.
One of my favourite products. I've always struggled with vitamin C's over the years, so to have something that's actually really potent and like calming on the skin is just ideal. So yeah,
I'm ready to take a bath in that, to be honest, at the moment. But yeah, like it's great. And we use some of these products as well. Not only selling them in the clinic, but we also use them as like, you know, part of our facials as well. And I would say that our clients like have the best reviews on the products. They feel like their skin is glowing afterwards. So like that's really good news for us. Was there any new products, any thing coming out soon from Jean-Marie that we would like to know about maybe?
So at the moment we actually don't have anything at present. I know there's a lot of things going around. So a lot of the current research within Gianmarini is combined treatments. So how these products will work in combination with things like laser to accelerate the results. So a lot of the research is based on those clinical studies at the moment. I find that with Jan though, like she doesn't launch a product just for the sake of it. So she always refers back to the clinical data, and all of her clinicals are based on the end result product, not a specific ingredient, so that you know that the clinicals that we have are based on the products that you are recommending to your patients as well.
So that's really good news as well to hear that, you know, patients can take these home with them and use them in between, during, after our procedures in clinic as well. Yeah. Thank you so much for going over that, Nina. Was there anything else you wanted to add or say?
I think it's just great to hear that you guys love the products, and obviously, you know, keep up to date with your training and make sure, you know, if you need any help, do contact us, of course.
Perfect. Well, I hope you have a lovely rest of the day. Thank you.